5 minutes, please.
Well, thank you very much. I'm Dr. Teale Phelps Bondaroff. I'm the chair and co-founder of the AccessBC campaign for free prescription contraception in British Columbia. And we're a group of young people from across the province committed to universal access to no-cost prescription contraception. And currently, BC has a patchwork of coverage and lots of gaps. And so I'm here to ask you today to include in the 2020 budget a policy that provide free, no-cost prescription contraception to all British Columbians. So access to contraception is a basic human right. And the reality is that too many people in British Columbia face barriers to accessing contraception, and this results in lots of unintended pregnancies. A 2016 study from the Canadian Medical Association Journal found that Canadian women who have been pregnant, 61% of them have had an unintended pregnancy. Across Canada, in 2014, 59,000 young people under the age of 24 had unintended pregnancies. And an unintended pregnancy can derail life plans, comes at significant personal costs, has high negative risk factors for the mother and child, and has significant costs on our health and social service systems. Consistent contraceptive use significantly reduces the chances of unintended pregnancy. But there are barriers that are preventing people from accessing prescription contraception. Canadian contraception providers identify cost as the single most important barrier to access. So an oral contraceptive pills cost about $20 a month. Injections can cost $180 a year. Copper IUDs may be $75, and hormonal IUDs may be as much as $350. These costs fall disproportionately on women and people with uteruses, and in particular, marginalized people, people in vulnerable situations, and youth. For example, a very recent study from the Pediatrics and Child Health report found that 10% of young people in Quebec had no access to contraception. Cost was a preventative factor for them accessing contraception or abandoning the contraception they were currently using. So cost isn't the only barrier. There are compounding barriers. So for example, there's complicated programs, there's travel, there's taking time off work, people live in remote communities far away from clinics, and there's a host of also unfortunate taboos around sex and sexual health and reproduction. And these barriers compound. But we can do something immediately about cost, and that would be delivering free prescriptive contraception in British Columbia. The most reliable methods of contraception, long-acting reversible contraceptives like IUDs, also have the highest upfront costs. And as a result, a lot of people in vulnerable situations are less likely to use these methods. However, when cost is removed, these people are likely to use them. So cost is a significant barrier. So under the current system, we have a hodgepodge of programs and sporadic coverage. There's application processes and means tests. And quite frankly, reproductive rights should not be subjected to a means test. There's also some people having to pay up front and then get reimbursed, which creates both a cost and a confidentiality barrier. You have some young people as well that are covered under their current parents' plans, but the problem, of course, is that they have to give up their privacy. And you should never have to give up your privacy to exercise your rights and access reproductive services. And also, a lot of plans don't cover all prescription contraceptions. So for example, an IUD is often considered a device and not medicine, so it's not covered under some pharma plans. And another one that's brought up a lot is that a lot of times people are dependent on their partner's money or their employment benefits, and this puts them at makes them very vulnerable to reproductive coercion and domestic abuse. So money is a significant problem. It doesn't have to be this complicated, however. So what we're asking you to include in the 2020 budget is free prescription contraception for all people in British Columbia. Similar delivery methods to what the government did in January 2018 with Mifgamizo, the abortion pill, which has been very successful, I understand. And this is a similar policy that has been done in the UK, France, Spain, Sweden, Denmark, the Netherlands, Italy, and so on. There was a news story a couple weeks ago about Colorado that had a program that offered IUDs to young people under 24. And this program reduced teen pregnancies by 54% and teen abortion rates by 64% over its 8 years. So these programs work, and they have a host of benefits. So first of all, they empower people. Money should never be a barrier to someone exercising their reproductive rights. They promote equality. For example, condoms are freely available in clinics and campuses and other locations around the province. And yet again, the cost of prescription contraception fall disproportionately on women and people with uteruses. They also promote health outcomes. As I mentioned, unintended pregnancies can have the most risk for mothers and babies. And it's good education policy. As a sex educator in the past, these kinds of policies help normalize the conversation about sex and sexual health and reproductive health. And particularly because you're the budget committee, this policy is revenue positive, which is rare in many policies. If someone can't afford contraception, they probably also can't afford the costs associated with an unintended pregnancy. And those costs then fall on the province. A 2010 study by Options for Sexual Health found that a program of universal access to prescription contraception in BC would save our government $95 million a year. A more recent study from 2015 in the Canadian Association of Medical Journal found that a cost of a program across Canada would be $157 million, but would save the government $320 million, for a total savings of $163 million. And these are only the direct medical costs. They're not including all the indirect costs further down the line in social services that often arise. And this is the reason, these benefits are the reason why the Canadian Medical Association, the Society for Obstetricians and Gynecologists in Canada, and very recently the Canadian Pediatric Society have all called for universal access to contraceptives. So that's what we're here to ask you to do today, is to include in the budget for 2020 universal no-cost prescription contraception. And I thank you very much for inviting us here and hearing any questions you have. Thank you.
Thank you.